Dozens of people who had the opportunity to stay at isolation hotels like this one here in Gallup not only recovered from coronavirus, but they're also getting a chance to tackle their substance abuse issues head on. Gerald G says he got coronavirus while partying with others.
We know what's going on about the virus and everything. We try to keep our hands clean, especially when we get out at the store, get back in the truck or car, we try to use the hand sanitizer, wipe down the bottles or cans and stuff before we start drinking it.
The weeks he spent in this little hotel room recovering has been a good adjustment. No distractions, like on the outside.
That's pretty hard because a lot of people I know drink. Everywhere I go, family members drink, friends around town.
Chi is one of hundreds of patients that are part of the HEAL initiative run by doctors from UC San Francisco.
Hey, Gerald. How's it going? It's Dr. Hatfield.
Overflow COVID patients from the Navajo Nation are brought here to recover.
And so we completed isolation on the 24th. So we just finished, about 2 days ago, Monday.
And then I signed up for a boarder.
A boarder is someone who chooses to stay longer. Gerald isn't contagious anymore and is waiting to be moved to a rehab facility to treat his alcoholism. Nearly 30 others in the hotel program have done the same.
There's definitely a huge benefit to having this program.
Officials say alcoholism is another epidemic they've been dealing with here for decades. Homeless camps with empty booze bottles are easily found across the city, which may have made the spread of COVID worse.
People are walking around in the streets, they're not social distancing, they're not wearing masks, they're sharing alcohol with each other, they're shaking hands, and it just exploded, the amount of people getting new COVID.
NCI, which is short for Notnegotia Center Incorporated, is one place that's been treating alcoholism for decades. Notnegotia is Navajo for bridge. They call this place the Bridge to Recovery.
It's very rewarding when people get sober.
People who are publicly intoxicated are brought here to detox. The 150-bed facility can be quickly overrun during certain times of the year. Director Dr. Kevin Foley says they had to shut down temporarily when COVID first struck because of the positive patients.
A lot of my staff were afraid. Some of them did get COVID, some of them quit. Some of them had to go into 14-day quarantine themselves.
He says COVID has highlighted the many health disparities among Native communities.
And you can see the statistics are all over the place about how diabetes, heart disease, all these other health issues are affecting Native Americans disproportionately. There's actually over 30% of Navajos that have never touched alcohol in their entire life.
But the reason for treatment is clear. State health officials say Native Americans had the highest alcohol-related deaths over a 5-year period. The epicenter? McKinley County. With COVID, Dr. Foley says there's been a shift with more people wearing masks now, but he worries about a possible second wave in the colder months, and that could put a huge drain on existing resources.
There's always a need here. There's an extreme need, actually.
I really appreciate what you're doing, trying to, kick the alcohol.
I want to get rid of that because I've been doing it too long.
As for Chi, he says he's done with that life, and now it's about resilience and to live the Navajo ideology of walking in beauty.
I'm tired of drinking. I've been drinking for a long time. And I just want to sober up, change my life,
With photojournalist Jonathan Deniazi, I'm Colton Schoen, KOB4.